Hello, everyone, and welcome to our COVID-19 Vaccine Confidence Project at UCLA in our interview series. Today, we're joined by Zachary Williams. Zachary is an MD PhD candidate at Vanderbilt University in the neuroscience graduate program. Zach graduated from Yale University in 2017 with a degree in psychology with a specialization in neuroscience. Currently, he's conducting his PhD research where he studies sensory processing differences in individuals with neuropsychiatric disorders. My name is Layla, and I'll be conducting your interview today, and we're also joined by our team members, Lucia, Nilpa, and Julie. And just to briefly describe our program, so the goal of this project is to help promote vaccine confidence in the disability community. We are particularly interested in your perspective as a physician scientist in training, and also as someone who works with the neurodiverse community, and we're really excited to learn from you. And so with that being said, we'll just go ahead and jump into our questions. So first, we would like to know a little bit more about your experience kind of throughout the COVID-19 pandemic when it comes to supporting patients as a physician in training.
Yeah, sure, absolutely. So currently I am in the going into the fifth year of my MD PhD, which means that I have done about half of my medical training and then I'm in the graduate school portion right now. I still do some clinical work, but I am mostly in the lab doing research on a day-to-day basis. So I actually haven't done a lot of in-hospital work since the pandemic started, though most of the clinical work that I do is in outpatient psychiatry. However, the landscape of outpatient psychiatry has changed a ton since the pandemic, as most of it has shifted to telehealth. And so that was a big growing pain when we started out. But actually, I think a lot of the patients really enjoy virtual psychiatric meetings. And in most cases, you don't really need to do a physical exam or anything. And it's much more convenient for people not to have to drive to the office. So on the whole, I think telehealth in psychiatry is here to stay. And it's going to be a way that a lot of different providers now help see their patients. I know I am staying telehealth with my own psychiatrist. And so I'm looking forward to keeping that going as long as I can.
Yeah, no, it's really interesting to see how kind of the sphere and the realm of medicine and how patient interactions occur with physicians have changed throughout the COVID-19 pandemic. So thank you very much for sharing that experience. I want to kind of shift into discussing neurodiversity since that's the main kind of goal of our project and the main community that we're working with. So could you please just describe if so, in what ways have neurodiversity related kind of issues or problems, solutions been addressed in your medical training or your scientific training thus far?
Sure. So as far as my medical training goes, there's been relatively little to do with neurodiversity and the standard curriculum. However, I was a LEND trainee at Vanderbilt, so that's the Leadership, Education, and Neurodevelopmental and Related Disabilities program. There's one affiliated with many major research universities, and so that's a specific one-year program where people in all disciplines, medicine, many helping professions, the physical, occupational therapy, speech language pathology, special ed, etc., all take this sort of interprofessional seminar where you meet frequently and talk about related issues in the disability community that range from sort of more medical issues to policy and sort of macro level things. And so I feel like the LEND program in particular did an excellent job of bringing up the topic of neurodiversity and how we as providers of all different kinds interact with folks with various disabilities and who are minorities. And I think that that program in particular has done a lot to, I guess, broaden my idea of how to best serve the folks with disabilities in my own community.
Okay, thank you very much for sharing that. And you discussed that your experience was mostly through the LEND program. Could you, if you feel comfortable sharing any maybe comments or kind of concerns you have, or just anything you'd like to share in regards to kind of bringing this maybe to the broader medical training community or even just the community as a whole?
Sure. I think that in general, just people in the medical school curriculum have so much pushed on them that they're already just trying to understand what they need to in order to pass their exams and get through, to the next stage. It's very difficult to push any additional curriculum items onto medical students, especially in their preclinical years, given how packed those are. And so, especially at Vanderbilt, where we take our preclinical curriculum and we shorten it into 1 year, there's a lot that does get cut, I would say. And that's probably one of those things. Unfortunately, this does leave a lot of medical professionals somewhat unprepared to interact with folks with disabilities, especially like intellectual and developmental disabilities, unless they get extra training in developmental behavioral pediatrics or some other sort of like specialty that really focuses on this community, child neurology, etc. But I think that your average internist really doesn't get any training in this, and nevertheless still has to provide sometimes primary or specialty care for folks with disabilities. And so I've seen in places like outpatient nephrology, where someone comes in and has autism, is sort of treated in a way that the physician doesn't really know what they're doing, and that this could probably be improved in some way, at the very least, by kind of providing slightly more education on the best ways to interact with folks with disabilities, and some various accommodations that are relatively low effort that can be done to help improve the quality of outpatient visits, especially.
Yeah, definitely. And hopefully in the future, that is something that, we hope to maybe contribute to and kind of bring light to some of these issues. And there are many activists, so hopefully we can bring more awareness to this, so that physicians can be kind of best prepared in order to work with patients with neurodiversity. And kind of you're in an interesting position being an MD PhD student. So of course you have your research as a big part of what you do. Can you describe how kind of, your training and from the medical sphere, but also maybe working with kind of the neurodiverse population, and how that has impacted your research goals?
Sure. So one of the reasons why I wanted to be a physician scientist in the first place was because while I primarily do research, I think that it is only as useful to do research as is that you're actually going to help real patients with their real problems. And if we're so disconnected from those patients that you don't actually interact with them in any way, shape, or form, then you often can miss the point and get stuck in these scientific minutiae that perhaps could be academically interesting, but may not have a big impact on people's day-to-day lives. And so one thing that I think is really important, as in my own work, is to maintain doing some clinical work specifically with my population of interest, which is autistic adults, and then understanding what those things that the autistic adults truly need are the things that I hopefully will be able to address in my research. And those things should be able to feed back into each other, and such that my research informs my clinical practice, and my clinical practice then feeds back to inform my research in some sort of virtuous cycle.
Yeah, no, I think it's fascinating, especially for the kind of physician scientist side, how you're able to kind of apply some of the clinical things that you see and the observations you see in the clinic to your research, and then vice versa. So hopefully we'll get some updates there. But I just want to kind of go maybe a little bit more broader now, and just to ask how your training has helped you when it comes to addressing patient concerns, specifically during the pandemic. If you ever had those experiences yet, being a medical student?
Yeah, so I mean, certainly I think that, it's probably been relatively limited compared to the folks who actually are there day to day in the hospital. But in outpatient scenarios, nevertheless, we certainly see a lot of patients who have, varying degrees of kind of anxiety and stress surrounding the pandemic. And so in psychiatry, especially, you get a lot of folks who are, clinically anxious, and then you drop a real threat of death by a virus on them. And so, then they're maybe not leaving their house, or, having major life changes, or some of them get COVID, have residual symptoms, and then these residual symptoms are amplified and become a sort of a psychosomatic syndrome and things like that. And so, there's a lot there to sort of unpack. And I think a lot of the discussions I've had with patients in the last, 6 to 8 months have been, included their reaction to COVID in some way, shape, or form. As since vaccines have become more widely available, I think that it's, much more the case that the people who are actually coming into the clinic and seeing me, face to face, or, in mass socially distanced scenarios, they tend to all be vaccinated and have a, relatively, a sense of, more comfort around them. But some of them still do, have, serious, life changes that have occurred since the pandemic that really haven't been resolved yet. And often that is the topic of conversation as well.
Mm-hmm. And are there any kind of specific topics you would suggest for research or trainings that someone perhaps in your position but a little bit younger, so maybe a doctor in training or another healthcare professional like a nurse in training, on kind of experiences that they should seek out that would kind of help them as they progress into their careers?
Hmm. Yeah, so I mean, I do think that one thing that is somewhat understudied and very interesting to think about are the people who have significant residual symptoms after experiencing an episode of acute COVID-19 pneumonia. And some of these people have relatively mild illnesses, but then have long-lasting symptoms afterwards, and we don't really know to what degree these symptoms are due to lingering effects of the virus versus inflammatory things versus other things. Yeah, but nevertheless, this is a patient population that in some cases can be quite disabled, and genuinely needs like a lot of care and sort of close monitoring, as they have sort of many unexplained, difficult to interpret yet very real symptoms. And so working on understanding that population, how they can be better helped, would be certainly a good path for someone who's looking for a way to make a real impact.
Yeah, thank you for sharing. I'm sure that would be very helpful for perhaps some of the people in our community who may watch this interview. And so, up until now, we've kind of discussed the neurodiverse community, and the pandemic as well. But there's also another component of our mission, and that comes to vaccine hesitancy. So, I'm curious to kind of hear from your perspective, particularly as a medical student and a doctor in training. Is what type of training have you received, or have you heard that other physicians have received, when it comes to working with patients or families/caregivers who are hesitant to take vaccines in general? And if not, are there any trainings that you would like to see kind of come up to help address this problem?
Yeah, so I mean, I think that on the whole, there isn't a lot of formal training. Again, at least in my program, though certainly this is a scenario that you see quite a lot on the wards, and so there is a lot of informal training, as it were, as you perhaps follow your attending around and watch them, attempt to convince people to get their vaccines. And this is, vaccine hesitancy comes in a lot of different forms. So I mean, for instance, lots of people who are getting their regular outpatient visits are offered flu shots and decline. Right. I mean, this is pretty standard in your flu season, and many people will continually offer flu shots at every visit, and perhaps not push the issue too much, but maybe eventually get someone to back, and say, okay, like why are you not taking this flu shot? What is the issue? And if you get at that deeper reason, oftentimes you can find a sort of underlying belief that like may or may not be changeable, but you can usually, at least by having that conversation, have an understanding of whether it's probably worthwhile to attempt to convince the person to have the vaccine. Certainly, I mean, I think there's also a place for knowing when to stop. I mean, the patient-provider relationship can be quite strained if the patient is very hesitant to have a vaccine, and you are just trying to sort of shove it down their throat, as it were. But nevertheless, I think that it's our job as physicians to work on educating our patients about the risks and benefits of having or not having the vaccines, particularly when it comes to the newer COVID vaccines, given the pretty significant effects that COVID can have on people of all ages. And so I think that in general, I certainly have my own informal training in addressing someone with vaccine hesitancy, though I think that it would actually be great to formalize this as part of medical training, especially when it comes to sort of the outpatient scenarios where you would expect to be giving a lot of COVID vaccines.
Yeah. And have you had any of those specific experiences with patients or family members who had vaccine hesitancy, whether that be with the COVID vaccine or another type of vaccine? And if you do feel comfortable, if you could share those experiences with us.
Sure. So, I mean, interestingly enough, I have had a couple patients who showed a bit of vaccine hesitancy around vaccinating their children, and their children being adults with neurodevelopmental disorders. And oftentimes this was, at least in my experience, due to some sort of misconception about the risks associated with vaccines, and potentially them being more, or being, I guess, talked up in some circles as more harmful than they actually are. And so, in the cases where I was actually present and able to talk to the patient and having that discussion about, so what do you believe these harms are? And then oftentimes we were able to sort of, I guess, re-educate the patient and say, no, that's not actually the case. There's really no evidence that the vaccine would cause this or contribute to that, and the data, in fact, show quite the opposite. And that, in some cases, has been enough to convince the people to, accept the vaccine. Obviously, this is not the case in all scenarios, and I have certainly had experiences where, we offered a vaccine, the person was very, vehemently said, like, no, absolutely not, please don't talk about it anymore, and we've dropped it because, it seems at that point you really, truly, cannot, they're not willing to listen, so it's not, helpful to try and push it on them again.
And when you have these sorts of conversations, are there any kind of resources that you would share, particularly for patients with disabilities, in order to kind of make that decision to get the vaccine, particularly COVID-19 or also other vaccines in general?
So I think that overall, as far as vaccine safety goes, if that is like the primary issue, sometimes I think that actually showing like real data or a subset of data that's sort of boiled down is good. I think that I'm not quite sure where the best place to get that for the COVID vaccine is, though. I mean, the CDC website tends to have very good information about vaccine safety in general. And I think in the past, I've also been successful with talking about my own experience being vaccinated and my own reactions to vaccines. I mean, so my own, as a person who has also received the COVID vaccine, I actually did this quite a while ago because I was in one of the clinical trials for the COVID vaccine, the Moderna one specifically. I ended up getting placebo in that trial, though I didn't know it until about the time when I got unblinded and had to get the real vaccine. But nevertheless, I was very gung ho about getting this vaccine, despite it being sort of experimental, just given that how pressing the need was and how important it was to show that I'm going to walk the walk in addition to talking the talk. If I don't feel confident in myself getting this vaccine, how can I go and tell anyone else that they should be?
Yeah, I love that perspective that you had, and I think on behalf of everyone, we can say thanks for being one of the people that kind of in the beginning maybe took that risk and joined in those clinical trials, as those are really necessary to get the process and the vaccine development pipeline going along. So a very, very big help for all of us in the community, because we're all affected by COVID-19 at this point in one way or another.
Absolutely.
When it comes to kind of resources and on the discussion of resources, are there any that you tend to use more frequently that you would maybe recommend?
That's a good question. I think that one, if you're a provider and looking for ways to talk to your patients, I do feel like the patient printouts that UpToDate has are excellent for a lot of different things. I'm not quite sure about vaccine hesitancy specifically, but if you're trying to get information about diseases or drugs, those are good. As far as sort of just giving patients like education about how to look up information on their own, I do tend to kind of give the spiel about, okay, so here are some like good websites. Medscape is a reputable source. You can have, don't just like type it into Google and take whatever you find, things like that. On the whole, I don't know that I can necessarily provide any specific resources at this time, though I'm happy to look into that a little bit more and get back to you.
Yeah, no worries. Thank you so much for sharing that. And so, we've spent some time talking about the more clinical side or the medical side of kind of vaccine hesitancy and neurodiversity and whatnot. But you are also a scientist in addition to being a physician in training, almost physician. So we learned that you do research on sensory systems and autism. So I was wondering if you could just tell us a little bit more about the research that you do.
Sure. So what I am doing my dissertation project on is the phenomenon specifically of what I call decreased sound tolerance. So a lot of autistic people have issues with environmental sounds, either being too loud or too annoying or too distracting for them to really be able to function in the environment with that sound. And beyond that, there are actually sort of different subtypes of this decreased sound tolerance based on what exactly about the sound is so aversive. And so in some cases, it's more of an anxiety disorder where the sound simply just triggers anxiety. In other cases, the person experiences the sound as exceptionally loud, even if it perhaps isn't that way to other people, or even sometimes causes physical pain. Other people have, just very strong emotional reactions of like anger, annoyance, or disgust to sounds. And so figuring out these different kinds of decreased sound type tolerance phenotypes and associating them with underlying brain mechanisms is kind of my goal. And then in addition to that, I'm also interested in the more clinical aspect of that, of whether or not symptoms of these different kinds of sound tolerance complaints are associated with different mental health concerns, overall quality of life, characteristics of autism, et cetera, both across the general population and in autistic people specifically.
And in your research, you do work with autistic adults, I think you mentioned. Is that correct?
Mm-hmm. Yes.
So in your experience working with these individuals, what do you believe is kind of the most important takeaway when it comes to developing support for this community?
Mm-hmm. So one thing that I found is fairly surprising to me, at least, is the things that appear to be sensory in origin oftentimes are influenced by a lot of things that are not sensory. One thing that I've noticed is that folks who have a great deal of anxiety tend to have many more sensory complaints or have amplified sensory complaints compared to folks who don't. Not to say that all sensory complaints are truly just anxiety, but there's certainly an interaction between the two such that anxiety can make people's sensory sensitivities a lot worse. So one thing that can often be done to improve someone's tolerance of the environment, or any environment where it might be difficult for them to access something like healthcare, is to reduce anxiety as much as possible in that time. For some, extreme measures may even be worthwhile, like a short course of a sedative or something to get someone in the door and vaccinated, or have a blood draw, something that is particularly difficult for certain people. But in general, I think there's a lot that can be done in sort of just the more, like letting people have a quiet space in the waiting room, or letting people wait in their car, or letting people bring their noise canceling headphones in, and then just signaling them in some other way than walking out and calling their name. And just little accommodations like this can certainly make the experiences a lot more pleasant for many people. And I think that more providers need to consider this. And I think it's also incumbent upon the patient to an extent to let their providers know how they might be able to be served. If the patient can think of a way that an accommodation might be helpful, telling the provider, many providers are happy to provide that. They just don't know that one needs it.
Yeah, no, thank you for sharing those. It's just really interesting to see how sometimes, accommodations that can make a huge difference can be really small, or something really easy to implement in a clinic. And so you did give some really good kind of points on that are relevant to like clinical work that physicians and nurses can do. But I was curious if you could elaborate on any additional accommodations when it comes to providing the COVID vaccine, or just even talking about vaccines or other things in general that may make the patient more kind of comfortable with opening up and having those conversations.
Mm-hmm. Sure. And so this is actually interesting because it touches on a project that I've been working on that sort of is trying to group different types of accommodations that autistic people need in healthcare settings. And what I've found, at least in that context, is that there are sort of different groups of people. Some people really, really enjoy details, and they think that if their best way to get healthcare, including vaccines, is just to have the person kind of load them up with as much information as possible. Use all the medical terminology and jargon, and give a really detailed response about what's going to happen, what this is doing in your body, etc. On the other hand, there are other people who get very overwhelmed with that degree of information, and that just makes them more anxious. And so some people really like it, short, simple, in and out, don't talk to me much, just kind of do your thing. And I think it really, again, is sort of on both the patient and provider to talk about how best they can be served. And for patients who really don't have the ability to communicate verbally, I think it's on their support person to kind of understand their needs, or what makes them more likely to have a successful healthcare visit, and talk with the providers about how that can be facilitated.
Mm-hmm. And specifically for what you described as a support person for someone who's caring for a child or a patient with a sensory disability. Do you have any kind of particular recommendations or tips on how to best provide that support?
Sure. I think that really, one thing to know is just to kind of take stock of the patient's limits. And there are certain scenarios where a person will become so overwhelmed, and that can like really ruin the whole day if they get to that point. So if you can kind of see the warning signs and know at what point a person is unlikely to make any more progress, and just say, okay, here, let's take a break, we can try this again. I think avoiding the explosive awful experiences of someone being extremely overwhelmed and having a meltdown in the office will make the likelihood of you having successful visits in the future much higher.
Mhm. Yeah, and that's really good advice, and I think will be particularly helpful for those watching this interview. So, thanks again for sharing all of that. And I do want to go back. I know we talked a little bit about how being in your position in an MD PhD program, you wanted to kind of learn from your research and kind of apply what you're doing in your research to your clinical practice, and also vice versa. Could you please elaborate more on how you kind of plan to do that, or ways you may anticipate that you will do that?
Sure. So I think one thing that I'm really interested in doing in the long term is understanding what one can do to actually treat sensory sensitivities. There's a lot that we've done a lot of research to show that they exist. They are correlated with this and that, but yet there's no real evidence-based treatment out there for these kinds of symptoms. And so one thing that I really do hope to do at some point is actually start doing some clinical research to address this specific symptom cluster, seeing whether, for instance, like treating anxiety with an anti-anxiety medicine actually seems to decrease this symptom in addition to decreasing anxiety. Or perhaps do people who don't have anxiety still benefit from anxiety medicines because they improve their sensory tolerance? And these clinical questions will probably drive a lot of my research in the future. And also, in understanding the mechanisms of these sorts of symptoms at a neurobiological level, perhaps you can glean new insights into what treatments may or may not be effective that could inform clinical investigations down the line.
Hmm. And also from that research perspective, do you have any ideas on some potential research efforts that could be made in regards to vaccine hesitancy within the neurodivergent community?
Well, I think one thing that is somewhat understudied in this case is specific reasons for vaccine hesitancy in this community in particular. It would be interesting for researchers to specifically find folks and ask them, are you willing or not to get the COVID vaccine, and why, and then try to classify the reasons into various groups, and see whether or not that means that some groups of people may be more amenable to changing their mind than others. If you can focus on a certain subset of the population who seems like they're most likely to, with the right information or prodding, like end up getting their vaccines, then obviously that's where you should put your public health efforts. Again, there's very much a section of the population that will not get their vaccines no matter what you do unless you mandate it, and even then they will probably figure out a way around it, because some people, they have very strong beliefs in that way, and it may not be effective. And so trying to, I guess, pull those people out of the pool of people you're attempting to get to have the vaccine, and focusing your efforts on the people who may actually change their minds would be my preference.
Hmm. Hmm. And just in a more kind of broad perspective, given that you do a lot of work on kind of the sensory systems and on autism research, for maybe kind of others doing research as well, and other scientists or healthcare professionals, do you have any recommendations on what types of research efforts should be taken, just in general, for supporting the neurodivergent community?
I think that one thing that is done very little as far as like how to do research on autism and other neurodevelopmental disabilities is this thing we call community-based participatory research. And so this gets you, instead of as a researcher coming up with your own questions and just assessing them in that way, you try and partner with like the folks who would stand to benefit from this research. Get a group of stakeholders who's willing to help you out, and obviously like compensate them and all of those things. But then by having this discussion with stakeholders about, so what, in this area, let's say, if you were looking at to improve healthcare for autistic adults, you can take a group of autistic adults and ask them, so, what about the healthcare system is causing you problems? Where would you like to see the research go? And, by having these stakeholders drive the actual research questions, you can often get much more impactful and valid research. And they can also often help you, avoid pitfalls in your methodology that may, you may not be asking some questions right. You may not be assessing exactly what they're talking about when they just give you their perspectives. And so by kind of including stakeholders at every stage of the research process, I think that you truly do have a greater chance of coming up with a project that can make a real impact.
Oh yeah, no, that was a really good point that you made. I think I've personally never heard of that before. So I think a lot of the time some research can be maybe detached from the community that it's intended to serve. So hopefully we'll be able to kind of continue on, particularly when it comes to clinical research or working with a specific service population, be able to apply some of those points that you made regarding including those stakeholders into the research process. But otherwise, that was my kind of final specific question for you. But before we leave, I would just like to ask if there's anything that I haven't asked you yet that you think is important to share with the neurodivergent community.
Well, I think that on the whole, we've covered a lot here. But if there's anything to talk about with the neurodivergent community and healthcare, it is if folks out there are having difficulties with the healthcare system, certainly it's not a great system at the moment. But learning self-advocacy skills and being able to know and verbalize or just tell people what accommodations are helpful for you goes a long way. And so, if at all you're able to implement those in your clinical settings, and if providers are willing to do that, and many providers are because they really do want to help their patients, then you can greatly improve the quality of the healthcare experience for both parties.
Wonderful. Thank you so much. That's all we have for you today. We really appreciate you taking the time to come out and talk to us. You have a very interesting perspective being in the position that you are. And we really appreciate everything you've had to say for us today. And we'll hopefully be able to spread this interview around. And I think on behalf of all of us, best of luck with your dissertation work and also with your future clinical practice as well.
Great. Thank you so much for having me.